Back now on Triad Today. I am honored to have this next guest with us for a number of reasons. J. Paul, Director, if we can see and meet Dr. Slade Moore. He's an orthopedic surgeon with High Point Orthopaedic and Sports Medicine, a Cornerstone practice. Comes to us courtesy of the good folks at High Point Regional Health System and Triad Federal Credit Union that makes these segments possible. I said honored to have you here because I think what a lot of folks don't know is that Dr. Moore was over serving as a surgeon in Iraq for about 7 or 8 months and came back a couple years ago from that. And thank you for doing that. I'm sure it changed your life.
It was an honor to do that and very gratifying. Able
to use the skills and I think you said to me earlier you learned some things too.
Yeah, I learned some things how courageous people can be and the dedication they have to serving our country, and just very gratifying and an honor to serve those people. Thanks
for doing that. Let's get on topic of joint replacement because that's what we promised we would talk about. Boy, this is something a lot of us are dealing with at a certain age. What's the history of this whole thing and the joint replacement procedure?
Well, the reason joint replacement has come into being, obviously, is people have arthritis, both the hip and the knee, even in the shoulder and the ankle. But over the last probably 100 years is when it first started to be developed as an entity. But really in the last 50 years, back in the early 60s, the first kind of modern era of joint replacement came into being with John Charmley and John Insull, both English surgeons that developed hip and knee replacement in the modern era.
Yeah, and now we're in this modern era where we'll get to recovery times and things later, but we've really gone just light years ahead, and I'm not saying it's a simple procedure, it's not, but, but it's a lot easier to go through now. How do I know, like if I'm having a pain in my hip or something? I know I'm simplifying this question because I don't understand some of these things, but clear this up for me. How do I know if it's time to have a hip replaced?
Well, there's several reasons for hip and knee pain, but in general, for hip pain, if you see your orthopedic surgeon, you have arthritis on your X-ray for various causes. There's several reasons to get a hip replacement. Really, the pain and the debility from the arthritis and how it affects your activities of daily living, and over time, as it becomes more severe and impacts your life. You will come to decide, at some point you're going to want to have that surgery. It's going to really affect you.
Yeah, and of course everybody says surgery. I don't want to have any kind of surgery. I understand that. I'm a chicken when it comes to that kind of stuff. But when it comes to that point, you want to do it. And that brings us to the surgery itself. How long a surgery does it take? If I go in this morning for it, what happens?
Well, you'd come in the morning or earlier in the afternoon, depending on when the surgery is. The surgery itself probably takes an hour and a half, depending on the surgeon experience and the difficulty with the surgery. But in general, about an hour and a half. You'd be in the hospital for about 3 days on average, depending on how you recover and your medical problems and so forth. And then the recovery after that will be anywhere from 6 weeks to 3 months.
What kind of results can we expect to see from this? Again, we're talking, I know that you deal with lots of different types of joint replacements and orthopedic issues, but we're talking about hip replacements now. What can we expect from that? What kind of success do we expect after the recovery time's over?
Well, actually, the success rate, if you look at the medical environment in general, hip replacement is one of the most successful operations ever done. Most patients, 97% probably, are very happy with the surgery, with long-lasting pain relief. And the reason to do the surgery is for pain relief, and improved function and activities.
Is there anybody, I know it's going to be a weird question, but is there anybody of any age or physical condition that should never consider this, even if their hip is hurting, they're having arthritis problems?
Well, I think there's probably certain circumstances where you would probably recommend against surgery, but in general, 95% of the time, 99% of the time, there's no age cutoff. Certainly younger the patient, we'd like to try to avoid it because the implants don't last forever, but there's no maximum age or minimum age necessarily.
So you've done them on teenagers up to people in their 80s, or?
The procedure has been done on teenagers. I haven't personally, but absolutely there is an indication for that at some times. And then up to 99, 100 years old.
Really?
Absolutely.
That's fascinating. I learned a lot with that. Hey, let's put up some logos once again. I mentioned this at the head of the segment. I want to do this again and give a plug and a shout out to High Point Regional Health System, also to Triad Federal Credit Union and their support, and to Dr. Slade Moore's practice, a Cornerstone practice. And you can reach him. Is there a number people should call, or just look you up in the phone book, or not, or just let's give out your home number? No, I mean, is there a PlayStation?
Yeah, office number was 802-2250.
802-2250. Dr. Slade Moore, thank you for all you do.
Thank you.
All right.